team and the organization team for inviting me over. So I'm going to share about PPE use in our hospital. But as the infection prevention team, we actually work very closely with different departments in the hospital, like in the operating theatre, EMD, isolation ward and general wards, to look at the infection control practices, setup, and also processes that's involved in that. So as we all know, PPE is actually designed to protect the healthcare worker against harmful patient pathogen. It creates a kind of a protective barrier for us. And understanding how transmission occurs for COVID-19 is important so that we can actually break the chain of infection by putting on the necessary and correct PPE. Next, please. Right, early on when COVID-19 came to our shores, there was a guidance from our Ministry of Health on the PPE recommendations to be used. Sorry, one back. So one slide back, please, thank you. Yes, so the Ministry of Health have recommended a set of minimum PPE to be used during the care of the suspect or confirmed cases. And this is used during the transfer management, during diagnostic procedures, treatment, etc. And in our hospital, there are also guidelines available on what PPE to wear, where you work, whether it's at the low risk or high risk area. The next slide, I will go through with you the specific PPE items that are to be used. All right, the first one is actually the N95 mask, like what Dr. Raj have mentioned earlier. This is quite crucial because sometimes staff may not be wearing N95 most of the time. They're not working in isolation wards per se, and they may either lose or gain weight, or even have some facial surgery which may affect their mask wearing to have a proper seal. So we'll advise staff who have not been wearing N95 in their daily work to actually go for a proper mask fit so that they have a very good seal. The next one is the face shield or goggles. This is primarily to prevent splashes, exposures to the eyes and face. And from what I understand in the OT setting, surgeons will usually like to wear both together if there are potential major splashes, to wear both the face shield and the goggles together. Next one is the long sleeve gowns. These are level 4 gowns in accordance to AMI standards, which can be used up to an hour or so, and provides fluid resistance properties as well. And next is the latex glove. Generally in the EMD or isolation ward setting, we did not wear sterile gloves, but in OT setting, definitely wear your sterile gloves. I understand some surgeons will actually prefer to wear double gloves as well. All right. The other important factor, which I not put inside my slide, is actually to wear a covered shoe, right? And if you do not have that, some would in fact put in a shoe cover or even a boot covers. So next. Next, I will need the help of Dr. Asim to play this video. This is actually the video of a sequence of the donning of the PPE with the minimum PPE requirements. All right, since there's no volume, I'll just give a bit of commentary. So before putting on your PPE, the key important thing is to perform your hand hygiene in NUH. Some areas may use 7 steps or even 8 steps of hand hygiene. That's fine as well. Following your hand hygiene, we always emphasize to put on whatever is actually on the top, your face. So that's the N95 mask. And when you wear your N95 mask, key thing is to ensure that you shape your mask properly. At the top, there's actually a metal sheet where you should shape your mask, perform user self-seal check, and check whether there's any air escaping or not. If yes, then you need to adjust your mask. And make sure it's actually at the crown of your head. Next, wear your or your goggles. Make sure it fits nicely. And rest of the intubation. So while putting on your long sleeve gown, ensure that you do not tie a dead knot. I mean, that's crucial because you don't want to be able to, you don't want to snap off the PPE later on, which may cause some aerosolization. So it's important to tie a ribbon knot and secure it, overlap, yeah, and for easy removal as well if you tie a ribbon knot. So following your donning of your gowns, we will emphasize to perform hand hygiene again before you put on your gloves. Okay, we can.
Just a minute, guys.
Right. So with PPE donning, the key messages that we are trying to say across is actually first thing is the N95 mask, because in our hospital, true, we do have staff who actually thought they can wear the existing mask which was fitted for them many years ago, and when they come to the clinical area, I mean there have been some gaps and they are not able to have a good seal. So ensure that crucially staff goes for their mask fitting again. A poster is always good as a reference point at prominent donning locations as a guide. But however, this does not replace the fact that staff must go through proper PPE donning and doffing and be certified competent. It will also be good if hospitals can also provide spotters, which means that staff who are there to just make sure that staff are actually putting on their PPE properly during the donning and doffing process. And finally, check integrity of the PPE. We can't be too sure that all our PPE come a good condition. There may be integrity issues. They could be torn. There's no string and things like that. So you don't want to compromise yourself. So ensure integrity of PPE even before putting it on. Next, we'll go to the removal video. PPE removal video. Thank you, Dr. Hassin. Yep. For PPE removal, always remember to remove what is the most dirtiest, which is the gloves, yeah, because you'll be touching patients and the environment. So remove your gloves. Remember, do not touch the outside of the gown. It's contaminated. Everything which is on the front part of your gown is contaminated. Pinch one side of the glove and pull out gloves gently. And secondly, with the ungloved hands, slide fingers underneath the gloves and pull it out gently. Yeah, the key message here is do not rush. Thereafter, perform hand hygiene. If you notice, there's a lot of hand hygiene moments here. Basically, you clean your hands after every removal of the PPE. So following that, remember I was sharing with you about removing of the gown. So you don't snap it, gently remove the string from top to bottom or bottom to top, that's fine. And untie it gently. And remember, do not touch the outer layer of the gown, that's contaminated. But however, you can touch the inside. So as you can see in the video, my colleague here is removing it slowly and touching the inside portion of the gown away from her. Yes, this video is intentionally slow motion so you can see the movement. Remove one side of the gown and then see she's touching only the inside portion of it away from you. And remember to fold it inside out. And after this is hand hygiene. And as earlier mentioned by Dr. Raj, if you are working in the operating theater with negative pressure room, it's always recommended not to remove your N95 mask within the operating theater. So next step is removal of the face shield, followed by hand hygiene. Step out of the operating theater, and you remove your N95 mask. And there's a technique to removing of the N95 mask, which will be shown in the video. And obviously, first remove the bottom strap and do not touch the front of the mask that's contaminated. Hold on to the strap and using the other hand, remove the top strap of the mask away from you and discard it immediately. All right. At this point of time, healthcare worker need to know that they cannot touch their face. You know, sometimes the hair is all flying and all that. Don't touch your face. Perform hand hygiene. You may be contaminating yourself. Okay, we go to the slide next, Dr. Hassin. So with the removal of PPE, key message, do not rush. Yeah, we go one slide behind. Key message is do not rush, always take your time. You're not rushing to anywhere. Yep. And obviously, we do not want healthcare workers or staff to contaminate themselves. So do not rush during doffing of PPE. Like what I mentioned earlier, where possible, encourage our spotter to be available. Sometimes when staff are in the theater for a very long time, they're just tired, they just want to take everything off, without thinking they may be contaminating themselves. So it's good to have a spotter to instruct them step by step. Hey, first remove your gloves, hand hygiene, remove your gown, hand hygiene, you're in good shape, take your time. Always encourage people, yeah. And the other key message is to perform hand hygiene at every step of PPE removal. Even though people may say, hey, there's too much hand hygiene, my hands are sticky and dry, but we don't want to take the risk, yeah. So we have to enforce this. Next slide, please. Right. So I think some of the speakers have already talked about PAPRs, and even though N95 masks, full PPE are good enough, aerosol generating procedures, some would like to actually wear the PAPR if they are doing intubation, bronchoscopy, mechanical ventilation, etc. It is possible to wear those.
I think we will skip the videos in the interest of time. They would be up on the website, and you can see them there. Razali, if you just want to go through these, it's okay, but we'll skip the video.
Sure. There's no video for PAPR, no worries. So these are the posters that we will put across the hospital wherever the potential use of PAPRs may be in the ICU or in the operating theater. Yeah, so we can go next. Yeah, if you need more information, you can just click on these are the two types of PAPR that we use in the hospital.